Greetings. Let us learn about rat tooth forceps. This is used for foreign body removal. And before we look at foreign bodies, there are certain foreign bodies that need to be removed, either emergently or urgently. So foreign bodies that cause problems include those that are sharp or those that have a diameter of more than 2.5 centimeters, or objects that are long, at least 6 centimeters, and certainly batteries, button batteries that are stuck in the esophagus. So these objects are at high risk of complications and they need to be removed. In addition, whenever somebody comes in with a foreign body and is not able to swallow his saliva, that indicates that the foreign body has completely obstructed the lumen of the esophagus, then those foreign bodies, especially if they are food bolus obstructions, should also be removed as an emergency. So let us look at a rat tooth forceps. Before we look at the rat tooth forceps, look at a biopsy forceps. Look at the cups. And this configuration of the cups of the biopsy forceps that we use to take biopsies, this is not suitable for foreign body retrieval. When you try to use this to remove foreign body, basically you will get frustrated. And don't waste your time trying to remove with a biopsy forceps that is not designed for removal of foreign bodies. Instead, you should pick the rat tooth forceps that has these jaws and the configuration of the jaws that allows you to remove the foreign bodies. There are a number of different varieties of rat tooth forceps depending upon the length of the jaw, either long or short, and then the configuration of the jaw in terms of whether they have additional teeth or not, like the serrated jaws. So you can have a short jaw with serrations, or a long jaw with serrations, or short or long jaws without serrations. And you may pick one that suits to remove a particular foreign body. It's a good idea to do the practice run before you remove a foreign body, especially if you find a foreign body that has not been a foreign body that you have not seen in your practice before, and you're not sure which instrument will work best for removing a particular foreign body. Rat tooth forceps is pretty good in retrieving coins and safety pins and stents. Stents can also be removed with the use of a snare as well. So when we are removing the foreign bodies, one of the most important things to keep in mind is to not drop the foreign body into the airway. That's going to be dangerous. And the second one is to make sure that as you remove the foreign body, you do not cause any mucosal laceration at the GE junction or at the cricopharyngeus muscle, or as the foreign body is coming up the pharynx into the mouth, which is almost at right angles. In that case, it is a good idea for the assistant or the nurse or the anesthetist to straighten the upper passage of the esophagus, hypopharynx, and mouth by giving a little bit of a jaw thrust and extending the neck to have a relatively straight path for these devices to come out along with the foreign body. I hope this is useful. Thank you.